Dispatched to a motorcycle accident, possible spine injury. Patient is unable to stand and was seen without a helmet. Local police is on the scene controlling traffic.
So PPE looks to be that my scene is safe. This is my only patient. I am going to head and consider ALS back or call for ALS backup, and it looks like I am going to need C-spine with a possible spine injury. Um, General impression of the patient. He looks to be about mid-20s. It looks like he has a large pool of blood looks close to the right calf. Hey, sir, how you doing?
Not good, man.
What seems to be the problem here? Can't move?
Can't move. My head hurts, man. I was in an accident.
So he is alert and responsive. I'm going ahead and manage this pool of blood on his right calf with a blood pressure wound, pressure bandage, and then I would go ahead and check his airway. His airway is clear and patent. He was talking to me and responsive, so I won't need an OP or NPA. I would assess his breathing, check for adequate ventilation. I would auscultate his lung sounds, and I would go ahead and put him on a oxygen non-rebreather mask at 15 liters per minute. Then I would go ahead and check his circulation. I would check his radial pulses. I would check his radial pulse. I would check for any major bleeding. I would check for skin signs. And I would initiate shock management by possibly putting a blanket on him. And I would make him a code 3 patient, transporting him immediately. I would then go on to checking vital signs, so I would take his blood pressure, respirations, and pulse. After that, I would go through a sample history. Is there symptoms that he has? Is that there is a possible spine injury and blood from the back of his leg? Then I would go ahead and ask him, any symptoms that you're having?
I can't really feel anything, and then my head really hurts.
Alright, are you allergic to anything?
I'm not allergic to anything.
And are you currently seeing a doctor for anything?
No.
Any past medical history?
No.
And your last oral intake, so anything that you had to eat or drink?
I ate like a couple hours ago.
Okay, and what was that?
Just a sandwich, some beer.
And events leading up to the
I was
mechanism?
riding my bike, going kind of fast, maybe 45, 50.
Okay, so he seems to be going about 45, 50 miles an hour, and he was not wearing a helmet.
No, it wasn't. She cut me off.
I would then go ahead and go through my secondary assessment. So what I would start with is the head. I would go ahead and palpate the head and check the scalp as well, check the nose for any bleeding. I would check the ears. I would then move on to the neck. I would check for any JVD or midline trachea, make sure it's not out of place. I would go ahead and palpate the chest, maybe the back of the shoulder too to find anything. I would still be careful. I would have my partner holding C-spine the whole time, just because he had a possible spine injury. I would go ahead and palpate the chest, check for any bruising or swelling or anything that seems out of place. I would palpate all 4 quadrants, and then I would move on to the pelvis, checking for anything here, anything's broken. I would then move on to the lower extremities. I would palpate the legs, and then I would check for CSAM on the legs. I would go ahead and check for capillary refill on the feet. I would ask him to move, or if you can tell me which toe am I grabbing?
Big toe.
Alright, and then if you go ahead and push, and now if you can pull. Alright, so he has movement there on his legs. I would move up to the arms and palpate the arms, checking for anything there. And then I would check for CSAM on his hands as well, or on his arms. Check for cap refill. I would ask him you can squeeze my arms as hard as you can, my hands. And he doesn't seem like he can move his arms, so then after that, what's that secondary? So that was, so he does have, I took care of that calf. There is, so there was major bleeding there. I would go ahead and roll him on his side and check his back, his buttocks, his general area, everything. At the same time, my partner would still be holding C-spine. By now, we probably would have had him in a C-collar. And then I would put him on a backboard, strap him down, and transport to the hospital. I would go ahead and reassess every 5 minutes. And that is it.
Okay.